As a podiatrist, our role is to treat any injuries in the lower limb, which is basically from the knee to the foot, and those injuries may involve anything from a problem with your muscles or bones or skin, or problems to do with your walking, or any type of injury that you may occur in day-to-day life. So there are certain disease types such as diabetes, which we're talking about today, that actually have quite specific problems that can present, and so that's a speciality of our profession that we manage. For people that have diabetes, your podiatrist is extremely important because foot complications associated with diabetes are the #1 cause for people being admitted into hospital. For people that may be what we would deem a low risk foot, so for somebody that has complications, like if you were to have a complication with your circulation or your ability to feel pain, which is sensation, if those are all intact and you have no problems, we would deem you as a low risk. And for that person, you would need to present to your podiatrist on a general basis, maybe once a year. For somebody that has loss of protective sensation, neuropathy, or reduced blood flow to their foot, peripheral vascular disease, they would be needing to see their podiatrist maybe every 3 months or every 6 months, depending on where they sit with their risk. So I will often, with my patients, teach them to look at their feet every day, look for any changes in colour or temperature, look to see if they can feel their hand rubbing over their foot, and if they notice that something has changed, that needs to spark them to think, I need to go back and see my podiatrist. But as a general rule, all podiatrists are trained to identify and be able to gauge their patient's risk status. For people that have diabetes, there are a couple of common complications that can occur. The first complication is that it can and does affect your vascular supply, so your blood supply to your foot. The unique thing about diabetes, which is why it affects so many different systems in your body, is that it affects the big blood vessels as well as the little blood vessels. So the first major complication is reduced blood flow to the foot. Now, without adequate blood flow to the foot, things don't heal. So if you were to have a minor injury and your blood flow isn't as good as what it could be, then you aren't going to heal as quickly, and that dramatically increases your risk of infection as well as non-healing, which can lead to ulceration, which is a break in the skin that can go down as deep as the bones and tendons. The other main complication is something that we call neuropathy, and what neuropathy is your ability to detect pain. So, well, that's the main one that we look for. If you can't detect that there's a problem, then you're not going to know there's a problem. And that's why it's important that people that do have diabetes just get into the habit of actually physically looking at their feet. And if they can't bend down to look at their feet, often I'll suggest that they get a little hand mirror and just put it on the ground so they can look underneath their foot. There's different types of nerves that tell you different things, but I think it's important that if you can't feel pain or can't feel your hand on your foot, then that's an indication. And unfortunately, whilst it may be good one day, it can change. So you need to be self-checking each day. If you self-check your feet daily, and if you notice a minor injury, whether that be a cut or a blister or an area of redness, have somebody check it. It will only take your podiatrist, your doctor, your diabetes educator a couple of minutes to check this minor problem, which can actually prevent a major problem occurring.